Welcome back, everyone. I'm Dr. Sherman Knapp. This is Dr. Deborah Knapp. This is Egrid, and we're going to be walking you through the Knapp Sports Medicine at-home assessment. And this is going to be looking at the forelimb. In the first segment, we talked about why we're doing this. We talked about performing gait analysis, why we're doing these evaluations, and how it's all about early identification, awareness, and prevention. So for us, what we're going to do is we're going to walk you through the exact same physical exam that we would do when we're palpating a dog that's coming into the clinic, from the toes to the nose to the tail, tail to the toes. Now, it's okay how you do this at home. It's probably going to be easiest if you follow along with this video. But if there's any questions, again, please feel free to reach out. If you notice any areas of discomfort or pain, please stop. Okay, none of this should be painful to your canine companion, and I want you to be accurate. Now, as you're feeling through the forelimb, make sure you have somewhere to take notes. Okay, it's good to have a journal so that if you feel certain areas of restrictions, tightness, you can write that down. So when you go in for your next evaluation with your veterinary healthcare professional, you can bring that with you. The other thing that can be helpful, just like we're videoing this right now, have someone video these with your canine at home. In other words, as you go through range of motion with the Carpus, maybe go ahead and have someone video that so you can see the range of motion, because later on you may say, you know what, it seems like it's restricted, and you can pull out the old video and compare, and you notice that, you know, we are off 10 degrees. Again, important for you to bring that up in your next assessment. This is by no means replacing your visit to your veterinarian or your rehab therapist, your acupuncturist, your chiropractor, but this is something where you're seeing your dog on a daily basis. You may see them once a month or even once a year. So I want you to be aware of your dog's body just like you're aware of your body. Okay, let's go ahead and get started. For me in the clinic, I'm typically starting at the toes, and I don't think people give enough credit to what we can see down at the level of the nails, the digits, and the feet, but it's really, really important, especially for our performance dogs. If you have an agility dog, dock diving dog, field trial dog, they're out in different terrains, they're going across obstacles, and really they can beat up their toes or their digits. So let's make sure that we really assess those. Now, Egrid's standing. This is a great dog to demo standing. She has great body conformation, and it'll be great for demonstrations. If your canine companion is uncomfortable standing for this long, go ahead, nice dog bed. We have a yoga mat here. You know, doing this on the floor is absolutely fine as well. Okay, so we're gonna go ahead. I do like them standing so I can feel for symmetry. First thing I may do is just kind of run my hands down the body and kind of look away and just feel, do I feel the same muscle mass, the same tension, the same texture in the forelimbs? Okay, so it's really, really important to kind of feel left versus right. If they're laying on their side, it may be difficult to do that. So maybe for a portion of the assessment, try to do that standing if you can. So we'll go down to what we call the paw. Okay, so think of this like our hand. Their anatomy is just like our anatomy. It's just that we're essentially walking on our hands, if that makes sense. So this would be their digits, so just like our fingers. And they have a nail just like we do, and the nails can give you a lot of information. If you have a dog with a neurological issue, they may be scuffing that nail, the forelimb or the hind limb, when they're walking. If you have a dog that has a lameness, they may not be putting as much pressure down, and you may notice that the nails are a little bit longer on that forelimb than the other forelimb or compared to the hind limbs. So really look at the nails. Say you do a lot of hiking with your dog, or your dog does some sort of sport. You come in, look in between each one of these little pads, okay? Because sometimes they can have grass-ons, they can have little sticks or pebbles that actually get stuck up inside of there. And if you can imagine, you're going for a hike and these things are digging into the bottom of your foot, it would be pretty uncomfortable. So make sure you look for that as well. So we're going to go ahead and to feel the paw, I find it easiest just to kind of lift them gently off the ground, look at the nails, assess, make sure they look like the same length as the other sides, that there's no abnormal wear. Then we're going to take each one of these little digits and we're just going to put them through a gentle range of motion, okay? It's okay if you feel a little snap, crackle, pop. It's just like cracking your own knuckles, as long as that's not painful. Again, if you notice any areas of pain, please stop, make a note of it. When we get to the actual digits, these are like our fingers, okay? We can lift each one of these up and we can place them through a nice gentle range of motion. Just like our digits, we may feel, or knuckles, we may feel a little snap, crackle, pop. Not a problem as long as it's comfortable, okay? But dogs are really hard on their feet, whether they're doing agility or just running at the dog park or hiking with you. So pay extra attention to these little digits and how their feet glide. As we work our way up, we're going to get to what we call the wrist, okay? And this is their Carpus, which is our wrist. And you should be able to very gently put the wrist through range of motion. And in fact, in most dogs, look how the pads go all the way to the back of the forelimb, okay? So this is a really excellent range of motion. Some dogs don't quite have that range of motion, and that's okay, but that's why I think it's important, get that picture at home, get the video to show what the limitation or restriction was, and follow that over time. As you're going through a range of motion, there shouldn't be any snap, crackle, pop that's painful. And when you get to the other range of motion, it should be what's called a nice soft end feel, almost like you're stretching a rubber band and it just won't go any further. Never should it have a painful end feel or like a clunk when you get to the end. So we're just going to go ahead and glide, nice range of motion. And then we also just take the wrist and we just feel, we're just going to wiggle it back and forth. I'm wiggling to the inside and the outside. That's the little collateral ligaments, just like we have in our wrist or we have in our ankle. Just something to feel and make sure it's comfortable and that the wrist is nice and stable. We work our way up the forelimb. This is essentially their radius and the ulna, or their extensors and their flexors, just like we would have in our forelimb. Now we're going to work our way up the forelimb, and we actually call this going proximal. So we're sliding up the forelimb, and this is their elbow, okay? And this is a really important area also to pay attention to. The most common cause of lameness in a dog's forelimb is elbow dysplasia or elbow arthritis. Very, very common. Whether they're born with this genetically or something from just running, jumping, and playing over time, this is a joint that really gets beat up. So I want you to pay special attention. I want you to just gently kind of feel the area. Make sure it doesn't feel thickened or uncomfortable. Compare it to the other side. You're feeling for any warmth, any area that may be different on one side versus the other. Now, when we put the elbow through range of motion, sometimes it's helpful to just put the carpus or that wrist through a little gentle flexion, and that will then many times allow you to get up into that deep flexion, okay? So we should be able to go all the way up into a nice deep flexion. Look how with egret we can get this forelimb to really come into contact. It almost like makes a V here, okay? There's no discomfort, it glides nicely, but that's a perfect range of motion. If we were to measure that, it would actually be 35 degrees. You don't have to measure that at home. Again, get your camera, get your video mode, and take a picture of how far your dog can go through that range of motion. Should never be a snap, crackle, pop. Should be comfortable when you're going through that. Working your way further up the forelimb. This would be the region where our biceps are. This is our triceps, okay, just like we have, and it works our way up to our shoulder muscles. Just kind of give a nice squeeze. Again, we can feel left to right to make sure there's symmetry. Muscles should be very soft. You should be able to glide them back and forth. If you get to any areas of sensitivity or trigger points, again, mark that down in your journal. Bring that up at your next consultation. As we work our way to the shoulder, this is something that I want you to also pay a lot of attention to. Very, very commonly, dogs can get shoulder injuries, shoulder conditions, shoulder restrictions or limitations, just like a rotator cuff that we would have. Okay, so how are we going to feel the shoulder? This is the top where the spine would be. This is the scapula. This is the humerus. So the shoulder joint is right here. Okay, so to put the shoulder through range of motion, and this is something that I really think having pictures and videos at home of your own dog is important, because dogs that do agility, field trial, a lot of the sports, this is the most common issue that I see in those dogs. So to come behind the elbow, just gently kind of cup your hand, then I just feel the front of the shoulder right here, and I just gently go into a nice glide. Okay, and look how everything's in extension. It's very comfortable. There's no spasm, there's no discomfort. I'm just holding this. This is also a very good stretch to do when you come back from performance or from your hikes or the dog park. So that was a very nice extension. Now what we can do is bring our hand in front of the elbow, okay? You can use the opposite hand if that's easier, and bring that arm all the way up, or limb all the way up into a nice deep flexion. So here you can see our flexion. No spasm, nice comfortable range of motion, okay? And so really, really beautiful flexion of the shoulder. Last stretch that we can do are biceps, okay? So just like at the gym, you've done your bicep curls and now you want to stretch those. We have our shoulder up in a nice flexion, and we're just going to gently bring that limb back into an extension. That's actually the bicep stretch. No sensitivity, egret's not pulling back and trying to get away from us. So really, really nice. The last thing that we'll do is actually the most important thing we do, and there's a condition we see in sporting dogs, in-house companions as well, called medial shoulder syndrome. This is what we would classically call a rotator cuff injury. Here, once again, just get behind the forelimb with your elbow, and just gently, and now just bring the limb out just to the side a little bit, okay? It's a nice glide. It feels like I'm taking a rubber band and it's just coming to an end, okay? No sensitivity. That's testing your medial shoulder, or in particular, your subscapularis tendon and subscapularis muscle. So as you notice, I took everything from the toes all the way up to the shoulder, palpated nicely. Now you're going to go to the opposite limb for a comparison. Take notes. Anything painful, stop, jot it down. Range of motion, get some pictures and videos so you have that long term to compare if you think something's changed. Okay? So thank you, Dr. Deb. Thank you, Egret. And we're going to move on to the hind limb.